Why is extrapulmonary TB so hard to diagnose? Imagine trying to find a tiny needle in a haystack, but the needle keeps changing shape and location. That's what diagnosing extrapulmonary tuberculosis is like. And like lung TB, which often shows clear signs like a persistent cough or weight loss, extrapulmonary TB can hide in many different parts of the body. It might affect the lymph nodes, bones, kidneys, brain, or other organs, each with its own set of symptoms. These symptoms are often vague and nonspecific, like pain, swelling, or fever, which can easily be mistaken for other illnesses. Because of this, doctors might not immediately think of tuberculosis, leading to delays in diagnosis. Another challenge is that the bacteria causing TB in these cases are usually present in very low numbers, making it harder to detect with standard tests. This low bacterial load is called a paucibacillary state, and it means that tests like sputum smear microscopy, which work well for lung TB, often come back negative in extrapulmonary cases. To confirm the diagnosis, doctors need to get tissue or fluid samples from the affected site, but this can be tricky. These samples are often deep inside the body, requiring invasive procedures like biopsies or surgeries, which carry risks and may not always be feasible. Adding to the difficulty is that symptoms of extrapulmonary TB can mimic many other diseases. For example, a swollen lymph node might be mistaken for an infection or cancer, and neurological symptoms could be confused with other brain conditions. Healthcare providers may also have less experience with extrapulmonary TB because it is less common than lung TB. This limited familiarity can lead to misdiagnosis or delayed diagnosis, especially in areas with fewer specialized diagnostic tools. Diagnostic tests like cultures or molecular assays are essential but can be slow or unavailable in some settings. Culturing bacteria from extrapulmonary sites takes time, sometimes weeks, and requires specific laboratory facilities. Newer tests that detect TB DNA are promising but are not yet accessible everywhere. Because of these hurdles, many patients experience longer times before a confirmed diagnosis, which can lead to complications or worsening health. In summary, diagnosing extrapulmonary TB is complex because it presents with a wide range of symptoms that often resemble other diseases. The bacteria are usually present in low numbers, making detection difficult. Obtaining samples from deep tissues can be invasive and challenging. Limited awareness among healthcare providers and lack of advanced diagnostic tools further complicate the process. To improve outcomes, clinicians relying on a combination of clinical judgment, imaging, tissue analysis, and microbiological testing. Early suspicion and comprehensive evaluation are key, but ongoing research aims to develop faster, more accessible diagnostic methods. If you suspect TB or have symptoms, always consult a healthcare professional for personalized advice and testing.